Excuse me, everyone. We now have all of our speakers in conference. Please be aware that each of your lines is in a listen-only mode. At the conclusion of today's presentation, we will open the floor for questions. At that time, instructions will be given as to the procedure to follow if you would like to ask a question. I would now like to turn the conference over to Mr. Chris Hund. Mr. Hund, you may begin.
Thank you so much. Hi, everybody. Good afternoon, and welcome to the October TeamSTEPPS webinar. Today's topic is From Evidence to Action, TeamSTEPPS Strategies for Nursing Education. I'm Chris Hund, Director for Clinical Quality at the Health Research and Educational Trust, and I'm here today to help moderate this webinar. Just a few rules of engagement for today. If you're on and having trouble with your audio, there are two different ways for you to be able to access the audio. The first is through the phone. So there was a phone number that was in the email that you received that said that you would be attending this webinar. You can call that phone number. If you do that, just click that little speaker up at the top. That will mute your computer speakers so that you don't have some sort of feedback issue. The other way that you can do this is you could listen to this webinar through your computer speakers, and then you don't need the phone. There will be a Q&A session that we're going to hold at the end of the presentation. During this Q&A session, we'll be answering questions that you've chatted in throughout the course of the presentation. So if you look in the bottom right-hand corner, you'll see a chat box right there. That's what we'd love for you to put all your questions as you think of them. If there are questions that are purely logistical or technical in nature about the webinar, we'll be able to handle that right away. If it's a question that's a little bit more content related and about something that one of the presenters has said, what we're going to do is look at all the questions as a whole and try to put them in some sort of good cohesive order so that at the end of the presentation, we'll have a nice conversation and we'll use your questions as the basis of the conversation. So that's how we do things on these webinars. So please try to get those questions in the chat box as you think of them. Just a couple more upcoming TeamSTEPPS events brought to you here by the TeamSTEPPS National Implementation Project. We have monthly webinars. We have them scheduled through August of 2016. Topics and speakers and registration information is posted on the TeamSTEPPS portal. That's www.teamsteppsportal.org. You could register right now for next month's webinar, which will feature some speakers from the North Shore Long Island Jewish Health System. We also have master training courses available, the real backbone of the TeamSTEPPS program at our 8 regional training centers around the country. Registration for courses in 2016 opens later this month in a few weeks. We also have recently announced our annual conference. So that's coming June 8th through 10th in Washington, D.C. So right now, if you're somebody that's interested in presenting at the conference or maybe having a poster in our poster session, you could head over to the teamsteppsportal.org and get on there and find the material you need to submit your ideas for a presentation or a poster. There's also an online course. So if you can't attend a TeamSTEPPS Master Training course and you're not able to travel, the same course is offered entirely through an online learning management system. And so right there, there's a website address that you can go to and take the online course. Just like the regular master training course, it offers continuing education credits. So it's a great place to go if you can't come in person to a course. So to learn more about all this stuff and to register for any of these events, head over to teamsteppsportal.org. If you have any questions for us about any of these events or any of the other things that we do, or just general content questions about TeamSTEPPS itself, shoot us an email at arcteamsteps@aha.org, and we have a very quick response rate, so we'll get back to you very fast. Okay, so I now have the great honor of being able to present to you who today's three presenters are. All three of them are people that I've worked with in some manner or another for the past couple years, and I'm very excited that they're together here to present today. We have Patricia Sharpnack and Laura Goliat, both from the Breen School of Nursing at Ursuline College, and they are being joined by Mary Trosclair, who's from the Charity School of Nursing at Delgado Community College in New Orleans, Louisiana. So we have Ohio and Louisiana today represented, and I'm very happy to be able to turn the presentation over to the three of them now. So I look forward to seeing your questions come in, and we'll be back to answer those questions at the end of the presentation. Okay, ready to go, ladies?
Thank you, Chris. Hello, everyone, and thanks for joining us. My name is Laura Goliat, and we are very grateful to the AHRQ, Health Research and Educational Trust, and Impact International for having us today and for their unending support. A little background from each of us. I first became involved with TeamSTEPPS when presenting at a national nursing conference. We had used TeamSTEPPS tools and strategies in a study with our leadership students. Pat and I, it was one part of the intervention, but we quickly realized that that was the part that most educators wanted to know more about. So not so much the results of our study. So we regrouped and spoke of TeamSTEPPS for the remainder of the session, pulled up the website, etc. The reaction and interest from educators was phenomenal. That was an aha moment, and I used that as the focus of my doctorate, and now it's pretty much a lifelong mission. We were once in that place where we didn't know of TeamSTEPPS but knew the value of TeamSTEPPS for students. We just didn't quite know where to start. So we're looking very much forward to sharing our journey, providing information, as well as discussing some lessons learned on the way.
And I'm Mary Trosclair. I'm at Charity School of Nursing, and my first exposure to TeamSTEPPS was through Tulane School of Medicine, who had offered periodic sessions where Dr. Crane, the dean, one of the deans at the School of Medicine, would invite our students to form small interdisciplinary teams, and he had attended TeamSTEPPS training. And through the sessions and through the work with Tulane, I eventually became a member of the faculty for the TeamSTEPPS Master Training courses at that training center. We introduced it to our students, and I'll talk more about that, but it really became meaningful to me when my mother was admitted to a hospital, and within the first day, there were 3 near errors that could have caused harm to her, and it just really confirmed my commitment to this patient safety initiative. So, Pat, why don't you join in and tell
Hi,
them?
This is Pat Sharpnack, and I too got involved with TeamSTEPPS fairly early. I had transitioned from the role as a chief nursing officer of an acute care hospital in Cleveland, and when I went into education, noted there was no TeamSTEPPS training, there was no teamwork and collaboration involved in the curriculum. So as Laura mentioned, I became very active in conducting some research on how we could involve that kind of paradigm or shift in paradigm for both our faculty and our students. So we began to incorporate pieces of TeamSTEPPS, not all of the constructs, but definitely many of the tools. And we found some major successes in our program, and we'll be talking more about them as we move forward and discuss how we actually integrated it into our curriculum. So I'm going to talk a little bit, while Mary is going to talk about the integration in the associate degree program, and Laura's going to talk a little bit about what we did at Ursuline College for the baccalaureate program. I'm going to give you some foundational information about teamwork and collaboration educational standards. And whether you're new to TeamSTEPPS or whether you've been active in TeamSTEPPS for some period of time, you can't not overemphasize the significance of the standards for interprofessional education, collaboration, and teamwork and collaboration competencies. The act of collaborating is usually considered a necessary component of successful healthcare professional activities, whether it's among individuals or departments within a given organization or among organizations. Yet the majority of healthcare program or health educational programs continue to remain wedded to traditional ways of education. And whether it seems like it's been a long time or a short time since we got involved with teamwork and collaboration issues, interprofessional collaboration in education and practice has been promoted for over 3 decades, both by educational panels, professional and educational organizations, and grant funding agencies. Interest in interprofessional collaborative practice proliferated in the healthcare arena during the 1990s. The Institute of Medicine reports, the O'Neill and Pew Health Professions Commissions, and the Pew Health Commission are just a few of the agencies that initially got involved. More recently, the American Association of Colleges of Nursing, AACN, published a white paper, Hallmarks of the Professional Practice Environment, in 2002, which included a focus on interprofessional collaboration. And then the National League for Nursing Initiatives included an educator summit in 2003 that focused on interprofessional education, leading to a position statement called Innovation in Nursing Education, a Call for Reform. And they also established a series of standards. Then later the AAMC, the American Association of Medical Colleges, the Accreditation Council for Graduate Medical Education, and the American Association of Colleges of Nursing recommended that graduates be competent in interdisciplinary collaboration. And although clinical practice demands close cooperation among the different professions, interprofessional education and experiences are seldom a part of the curricula in the various schools of nursing in the United States. And if you could advance the slide, please. Have you advanced?
Yes.
Okay. The difference between successes and failures is a great team. Don Berwick quoted something very interesting. He said, an attending physician on rounds strode into a hospital room with an entourage of medical students, and he asked the patient a question: how can we do a better job of caring for you? And the patient, a 15-year-old boy named Kevin, had been in and out of the hospital 30 or 40 times for treatment for short bowel syndrome. And the veteran of the healthcare system said he's been very happy with his care that he had received over the years. But when he was pressured, he said, I have great doctors and nurses here, but can you please talk to each other? So teamwork training for interprofessional collaborative practice in health professions education has lagged dramatically behind those changes in practice, continually widening the gap between current health professions training and actual practice needs and realities. So to spur educational change after releasing the 2 reports on safety and quality, the IOM sponsored a summit on health professions education. And the attendees at the summit identified 5 competencies central to education of all health professionals, and one of those was the teamwork and collaboration. And it was noted that many successful examples of interprofessional education exist, but that interdisciplinary education has yet to become the norm in health professions education. Okay, could you advance, because I've lost the slides. Okay, so every player in the healthcare system can play a role in enhancing education and bridging the gap between academia and practice. But most experts believe that in order to deliver high-quality, safe, and efficient care and meet the public's increasing complex healthcare needs, the educational experience must shift from one in which health profession students are educated in silos to one that fosters collaboration, communication, and a team approach to providing care. The goal is to pave the way for a future in which interprofessional healthcare teams will provide care that leads to better healthcare outcomes, improved patient experiences, improved efficiency, and increased job satisfaction for health professionals. Oh, hopefully.
Call for radical transformation.
Call for radical transformation. I finally have the slides back. Thank you. It's nice to have them there. Better groundbreaking publication on behalf of the Carnegie Foundation really found that a significant gap existed between today's nursing practice and the education for that practice. In order for nursing education to keep pace with practice innovation and other changes in the healthcare delivery system, education has to adopt changes incrementally while the practice environment becomes more nimble and therefore can more easily integrate change. Part of this is despite the 2003 IOM report that asked for radical change in health professions education, we have continued to remain in silos, assuming that despite the fact that students didn't learn this in their academic program, that they would adopt it in the culture they were in. The fact is we must change the culture pre-licensure, and practice must definitely connect between academia and vice versa. The solution will only come from an intentional change in the methods that we use to educate future nurses, which is possible by altering the traditional preparation nurse educators receive. With an effort to advance the bridge between clinical and academic settings on a larger scale, more focus will be placed on faculty engagement and integrating evidence-based clinical tools throughout the curriculum, sharing information online and in conferences, and a more thoughtful leadership on education and practice transformation. TeamSTEPPS is one way to bridge that gap. So, our charge, teamwork is essential in the provision of healthcare. And the division of labor among medical, nursing, and allied health practitioners mean that no single profession can deliver a complete episode of healthcare. While there's little formal training in teamwork skill development in undergraduate and postgraduate education, teamwork skills are largely learned on the job. So in healthcare, where patient outcomes are dependent on effective interdisciplinary teamwork, there is a need for better preparation of healthcare professionals by the use of TeamSTEPPS Integration for both initial program requirements through to graduation. And I will pass this on to Mary.
Thank you, Pat. Charity School of Nursing is located in downtown New Orleans. We have integrated the entire fundamentals course over the 4 semesters of the associate degree registered nurse curriculum. As far as the order of the TeamSTEPPS modules, we looked at our conceptual-based curriculum and then decided to rearrange the order of the modules to align better with the course content of each of the 4 semesters. We do invite faculty and students from our allied health programs and from Tulane School of Medicine to attend our sessions, but the logistical challenges of matching schedules often has resulted in small numbers of attendees. To make the number 100,000 deaths and 100,000 lives lost per year, when we wanted to make this very tangible to our students, we use an image of the Superdome, the home of the New Orleans Saints, filled to capacity, but that was only 80,000. We have to add our other arena, which is about a 20,000 capacity. So when we talk to the students to make it a very tangible, very real number of our sense of urgency, we use these images again and again. Okay, so during our first semester, let me see if I can advance this slide. There, great. We have 4 semesters. In the first semester, we have 3 events with student learning outcomes that relate directly to patient safety and to TeamSTEPPS. The first occurs in the simulator lab, and it's actually a patient safety observation. These are brand new nursing students. We have them rotate through 3 patient care settings. 2 are an acute care setting, and 1 is a home-based setting. In each of the settings, we've embedded multiple common errors and safety risks. The students are given a brief profile on each patient, and they work in teams of 2 or 3 to enter the room, and they have approximately 2 minutes to make their observations. After they've rotated through all 3 of the settings, they are assigned to work in small groups to develop a plan of response to correct the errors, including how and to whom the findings should be communicated. When we get the whole course, the group, together and we debrief, we ask the teams to report their findings and to role play that communication that they think would be indicated. Well, being very new in healthcare education, their communication is usually very scattered and ineffective and incomplete. So we ask them if they think that a structured tool to organize and improve their message would be helpful, and they do realize that it would be. So we tell them that in a couple of weeks we'll talk about these tools as part of our introduction to the TeamSTEPPS course. And that is our next encounter. We formally introduce the students. We introduce TeamSTEPPS. We include 3 modules in this first session in the first semester: the introduction, communication, and team structure. We show them that image of what 100,000 lives really means. And we use the very powerful video by Sue Sheridan. We customize the team structure module to help orient these new students to how structures of teams exist in academic medical centers and in private acute care facilities. So we introduce the chain of command of the healthcare team in our region, both in medicine and in nursing. We don't spend a lot of time, but we just briefly explain that there is this chain of command: a chief medical officer, an attending physician, chief resident, intern, and med student. And then we describe the nursing organization structure: chief nursing officer, division managers, etc. This groundwork helps them to understand the significance of some of the barriers that affect patient safety, especially related to the hierarchy. The last event that we offer is an interdisciplinary one, and it's near the end of the first semester. We formed a mutually valuable and valued partnership with Tulane School of Medicine, since Tulane does not have a School of Nursing and we do not have a School of Medicine. So what we've done is we match approximately 150 first-semester nursing students with approximately 200 first-year medical students from Tulane, and we put them in small groups of about 6 students, mixed pretty evenly. We pair the students at the end of their first semesters, so this results in the nursing students actually having more actual clinical experiences than their medical student colleagues. This was a deliberate pairing, with the objective being that new medical students may not have an awareness of the role and knowledge base of the nurse. This session is directed by the course director of Foundations of Medicine. He discusses this need to train as teams and to learn how to communicate effectively and clearly, and to develop an awareness and appreciation of one another's roles. The students are given case studies to work on, and often the nursing students lead the discussions and offer suggestions that have not even been formulated in the minds of the medical students yet. Some of the nursing students actually use TeamSTEPPS tools, such as SBAR, which they're most comfortable with, and they organize their exchange of information using SBAR, and the medical students observe and hear this. All of this is designed to provide a subtle exposure that healthcare of today and tomorrow must be a team effort with every member contributing for optimal patient outcomes. Another very creative way that some of our faculty have adapted TeamSTEPPS is to take the tools and to use them as part of our everyday working when we go to the clinical sites. One faculty member, a couple of them actually, used the I Pass the Baton tool to help the students share what information about their assigned patients. They also use it when they report to the nurse and then take report from the nurse. It just helps the beginner know what would be expected in a handoff report like that. Then in Level 2, the students have a second nursing course, and now we add a special populations course, which is mental health nursing. So the TeamSTEPPS module, mutual support, aligns very well with the content at this level. especially with the tools of advocacy and assertion and conflict resolution. The simulation that's offered to students at this level includes the care of a patient whose condition changes, and this change is significant and would require notification of the physician. Many students use SBAR for the communication, but are surprised when the physician, played by a faculty member, disregards the importance of the call. So we're hoping that the students go beyond use of SBAR and consider the use of CUS to express the concern for that response. If they don't, we do discuss it during debriefing. The next level is level 3, and again, they have another nursing course, but they also now have the leadership and management course of both adult and pediatric patients. There's a second special populations course, which is care of the childbearing woman. The modules that we present at this level are situation monitoring and leading teams, which certainly match very well with the content at that level. The simulations that we've had have varied over the semesters. We have one that's a postpartum hemorrhage with a severe deterioration in the patient's condition, and the healthcare provider is notified but delays response. So we're hoping the students will use the 2-challenge rule and the CUS tools. If not, again, we discuss it during debriefing. A more recent simulation that's been very effective has been the care of a pediatric patient with asthma in the emergency department. During that simulation, if we model it for the students where the faculty are in the role of the nurse, we use all the TeamSTEPPS tools in communication, like when we call the physician, when we hand off the patient to the ICU nurse. Now, in actual clinical, the students at this level are engaged in first-line leadership and management of multiple patients. So they actually lead teams for the first time, delegating assignments and providing feedback, which, of course, is part of good teamwork. And then in the last semester, we present a broad overview of the TeamSTEPPS tools in the putting it all together. We present a scenario in the classroom which involves a team of 3 healthcare workers and the scenario involves a personality conflict that's affecting patient safety. We hope that the students use the desk script. If they don't, we discuss and debrief and suggest that they do. The ultimate experience with TeamSTEPPS at this level, the students are approaching their termination, their graduation, is when we conduct the code workshop. We do this in teams of 7 or 8 students, and we present ACLS scenarios where they must resuscitate the patients. Each student is given a role and reminded only keep your patients safe. With the small number of students and with 2 faculty present, we're able to repeat the resuscitative events and debrief between each one, not only comparing what's the quality of our care, did we follow the ACLS protocols, but how was our teamwork, how could we make it better? And so we model the use of checkbacks and call-outs. The feedback that we got just recently from this group that we just did last month was so positive as far as now they understand how these tools help them to be effective as teams. Then the last thing we do is we show them the video called The Dancing Guy, and it's a very funny video. It obviously occurs at some big music festival, and the students really like it because there's this guy and he's dancing, if you've not seen it, and, you know, he's just so unusual looking. But the students love it because it shows that sometimes you just have to step up and lead and follow. And that's what we discuss there, you know. Upon completion of this level, the students are near graduation. We do present them with a certificate of completion of the fundamentals course for their portfolios, which is very helpful to them. Okay, I'm going to turn this over to Laura, and she'll tell you how Ursuline integrates TeamSTEPPS.
Thank you, Mary. In our baccalaureate program at Ursuline College, we have many similar strategies for integration and take a deep dive to provide repeated dosing throughout 3 to 4 years we have the students. As we know, the first step in Cotter's change theory is, again, creating a sense of urgency. This is key, and it must be done early. Urgency is a powerful inclusion in the TeamSTEPPS introduction with patients and families that have been profoundly affected by medical errors, and it resonates with students. Seeing the faces of error, as we know, is a difficult, sad, heart-wrenching place to be, but it's necessary. It sets the tone for students to be the change that they and we need to happen. So we equate the number of lives lost to communication team errors, to a jumbo jet crashing every day. We look at individual stories of victims of errors and work backwards, what went wrong individually, systematically. We access websites such as the Patient Safety Movement that have testimonials. We invite patients or their families to come speak about their experiences in a gentle way, but it is very powerful for the students to see. Most recently, we invited Mr. Chris Jerry, who was the father of Emily, a child who was lost to an error, and he spoke to our students, and it provided great impact. The debriefing was very powerful, which you could imagine. We also ask who in the classroom has been the victim of an error or their families themselves. That resonates very much too, and then we discuss. In 2013, we conducted a small study with our traditional and accelerated nursing students to look at the impact of a TeamSTEPPS fundamental program on their attitudes towards teamwork. As we know, attitudes can be important determinants of behavior. We used the T-TECH instrument and found that attitudes were significantly impacted in pre-test, post-test comparisons. Since that time, we have added approximately 100 undergrad nursing students with the same instructors and prescriptive program, and results are the same. Students loved it, and the team attitudes were positively and significantly affected by it. This was important information to bring forward to faculty for their buy-in as well. There are more details located on the TeamSTEPPS portal on the AHRQ website on this. So for curricular integration, we tackled a 3-phased approach. Basically, foundations would be the under 100 series, intermediate application 200, as well as advanced 300 series. Since then, we have integrated this approach, but before commencing our journey, number one, we had faculty master team train. That was key, that they heard this from someone other than Pat and I, who were the champions. Number two, we convened a TeamSTEPPS integration committee. And number three, we have TeamSTEPPS faculty journal clubs, lunch and learns, potluck lunches to provide status updates throughout the semester. Our next event is in November, and the focus is on using a TeamSTEPPS approach to provide mutual support to faculty colleagues. So again, the curricular integration, we know the levity and humor about the penguins. It's a great aspect of the program, a common ground for all. So we talked briefly about their habitats and the constructs they must exemplify in order to live, but also that it's not innate in us to be team players so much. It's a carefully learned skill and behavior. So we've affectionately dubbed our TeamSTEPPS integration program as TINE, TeamSTEPPS in Nursing Education. So level 1 series, entry level, the students are very green. So we define team structure, the 4 constructs. Team structure, we use lifeboat and team building exercises, the all favorite paper chain exercise. We also emphasize, as Mary had stated, the roles and responsibilities of the whole team. I would argue most people don't know, even as a seasoned nurse. I didn't know all the roles and responsibilities of the total entire team. As far as the SBAR, while they are not ready at this level for providing situation or the background or the recommendation, we focus on the assessment piece. This is congruent with their health assessment course. It is practice, practice, practice from there. In fact, they need to email us if they need to communicate with us in SBAR format. We also access the QSIN site, the Quality and Safety Education for Nurses. It's an awesome site and resource for team and teamwork assignments, team building assignments, and it has, as we know, teamwork and collaboration is one of its core competencies. We look at YouTube videos, building trust. We have students in clinical shadow members of the healthcare team. We provide team reports in the clinical setting on the FTNA for the patient, the housekeeper on duty, who is the chaplain, what do they do, in addition to the patient, physician, NP, physical therapist, speech therapist, occupational as well. We, like in Mary's program, we call the pre-conference the team brief. We conduct huddles, and we also debrief, and that is called our debrief as the post-conference. In level 2, as they advance, we expand everything. The SBAR now is the ISBAR. They can identify themselves. They're learning to describe their current situation. They're providing pertinent background information, and they are timed. We view TeamSTEPPS videos, but we've also developed many of our own. They're short 1 to 2 minute videos that highlight some of the issues and concerns we see in nursing and amongst the healthcare team. They demonstrate the wrong way, the right way. There's a reflection and a debrief, and it's very powerful. So we're exploring having them develop videos of their own in the clinical setting that TeamSTEPPS tools and strategies could and should have been applied. Again, we access QSIN as well as identify assignments there to reduce errors and with a special focus on communication. Students in clinical act as the charge nurse for their peers, and we have embedded conflict management exercises within their experiences on how to, an example would be how to approach a team member who may be on their cell phone when a patient's call light is on. We have them participate in patient-centered care rounding with other disciplines and beginning to look at the situational leadership in those areas. Level 3, the 300 series, is again a further progression of 100 and 200. They are SBARing to physicians in simulation as well as in practice, many SBAR phone conversations. They, in their critical care rotations, they have handoffs using I'm Safe, QI projects integrating constructs. They have a culminating seminar with simulation, and we're working on it to make it more interdisciplinary. And they have delegation activities. They also, in clinicals, present TeamSTEPPS to the staff and on the sites of their rotations. And Pat, did you have anything to add about the 300 series?
I think, the impact of the TeamSTEPPS fundamentals training is probably pulls it all together for them, and that's at the 300 level, where they can really see all of what they've learned during the 300 series pull together and actually make a transition to practice.
Yes. I had mentioned the instructor-developed videos, constructs, and tools. These are key. It gives you an example of 3 of them, and I know you can't see them in action, but these are 2 faculty and team members at our school. They needed no script because it was based on what had happened maybe in practice, and they highlight examples of the one on the upper left and the bottom are 2 nurses about their heavy patient loads. The first version that we show them, they communicate and they're kind of commiserating with each other, and nothing gets done, only complaints. And the second version is 1 steps up to provide a solution, but it brings in all the constructs. So it's a great debriefing piece. In the upper right, the new nurse comes into the picture. You don't see that, but she is needing to administer insulin, but must do so with her preceptor. The preceptor is in a position of authority, as we know, and too busy, so she just takes off her badge and tells her just to use it. What do they do? So they're great opportunities to learn in addition to the resources provided by TeamSTEPPS.
So in addition to those videos that we use, that the faculty actually develop, we try to use videos that the students can relate to that are non-medical examples of exceptional teamwork in order to transfer their thinking to the disconnect that they see in the healthcare field. Mary mentioned one of them, the dancing guy, which gives them a sense of the construct of leadership. The Blue Angels is a real powerful example of mutual support and situation monitoring. The emotional impact of pulling together as a team with the LeBron James video by Nike. The Red Bull NASCAR video that's available through YouTube is incredibly powerful because it talks about the team all being up to par and supporting every single aspect and evidencing all of the constructs of TeamSTEPPS. And finally, if you go to the Miracle on the Hudson and you look back at Sully and the impact that he had and the conversation that goes on during the black box recordings, you get a tremendous, powerful impact on the students as to the importance of quality and safety in healthcare. Additional resource, there's an ANTS video that deals with the power of teamwork and the role of leadership. So it's not only about directing and looking at mutual support, being aware of the situations, but how do you conduct yourself as a leader? And there's many others that are available on YouTube, whether you're dealing with situation monitoring and the change blindness experience, or what bad teamwork looks like with the birds that are definitely bullying each other. It gives students a frame of reference for which to build teamwork and collaboration competencies in healthcare. Some of these listed here are resources available for interprofessional education, and those are all listed on the slide. Many of these resources provide videos, literature, lesson plans, and teaching strategies for effective teamwork and collaboration, IPAC competencies, and similar programs. SLU, or St. Louis University, and its Center for Interprofessional Collaboration and Research has excellent learning modules, and IHI has complete modules for student use. At the end of the course, we mentioned at our 300 level, we make certain that our students pull it all together with a fundamentals course, and we also provide them with a certificate when it's completed. That certificate they put into their portfolio, and they use it when they're looking for their next position. And it really has been powerful to our practice partners to see that we are really pulling this information into their total educational plan. And finally, practice makes permanent, not perfect. And that's not my personal quote, but it really comes from Aristotle that says, we are what we repeatedly do. Excellence, then, is not an act, but a habit. The effective use of TeamSTEPPS requires that you act representative of the team. It must be part of your culture of the faculty and of the school, as well as the way that the students are treated. Integration must be at the core of the implementation of TeamSTEPPS. It cannot be additive, or students will not understand it within the context of their education and professional role. The constructs must be incorporated early, repeatedly, and the language used consistently. TeamSTEPPS constructs and tools must be also level appropriate, and Laura and Mary both mentioned that. Asking a first semester student to understand the recommendations of SBAR is not level appropriate. Situation monitoring cannot be understood through osmosis. Teaching must be deliberate, intentional, and redosed frequently on a formative basis to ensure that students are building their competency level appropriately. Every opportunity to operationalize and practice through prescriptive clinical assignments is needed. For example, shadowing members of the healthcare team to fully understand their roles, providing opportunities for senior-level nurses to meet with medical fellows and understand each other's perspective when doing an SBAR, working side by side with a nursing assistant doing their job. All of these create a sense of urgency for change and create the sense and desire to learn how to develop themselves as a teamwork.
Well, as we communicated our experiences with TeamSTEPPS, we thought we would share some of the barriers that we encountered introducing this entire TeamSTEPPS course in nursing curricula. And so then we categorized the barriers. Some were generated by students and some faculty. For the student, what I saw, especially as you introduced this, is the naivety in a sense, or their idealism. They often can't believe that we don't communicate, or they maybe have not had a personal exposure to an error. So they don't always have that context to understand the tools. And the other barrier that I see is that there's a lack of opportunity to use what they're getting as far as these tools and strategies in real clinical settings that are using them as well. So they're sort of getting tools without foundational understanding of teamwork and how it all develops and how it exists in our practice facilities. As far as faculty barriers, well, classic, I'm sure all of us will relate to this. There's no time to add any more to our curriculum, and that's why Pat referred to it as it really should not be additive. It should be integrative and just permeate everything. We'll know we've changed the culture here in nursing ed when we see it that way. The other problem is sort of the same as with students. Some faculty do not see the value because they're not seeing it used at the affiliating agencies where they do their clinical. Pat and Laura, any other comments regarding barriers that you've faced in Cleveland?
I think what you had to say about separating out the tools from the constructs,
yes,
doesn't provide the students or faculty with a foundation and situational application required for the integration.
You're right.
I think oftentimes people think that they understand TeamSTEPPS because they understand the tools, but you really have to integrate the constructs into the education so they know when it's best to use the tools.
Correct. I agree.
So the future of nursing, as well as other health professions education, must practice in a new paradigm and really
Correct.
be the change we need to see. When we look at celebrating small successes, they're really big successes. We actually had students return to us as new grads, and they used the tools and strategies to avert errors. So that was, I think we would all agree that what better time to integrate and solidify the constructs and tools and strategies of TeamSTEPPS than early in our programs, much like learning a new language, because it is a new language. So no matter what level of familiarity we have with TeamSTEPPS, we know our common goal is always improving quality and safety. This program, wholly free to you and readily available, offers the powerful solution to mitigate communication and collaboration errors and has great impact for students on the way they will deliver care someday.
And if I can add, it has great impact for faculty. If you can change the paradigm with the faculty, you will change the paradigm with the students. Because the faculty who can work together as a team and that uses the language of TeamSTEPPS really makes the role modeling for what the student does in actual practice.
It's a great point, Pat, and TeamSTEPPS for faculty. And we know when we speak about TeamSTEPPS at other institutions that we focus on TeamSTEPPS for patients and sometimes TeamSTEPPS for the faculty themselves. And,
exactly.
So it's a very powerful and customizable program for sure. We look at some of the comments of students as well, and in the evaluation pieces, they're happy to stay extra and fill out those evals, which we know isn't always the case, but some of the things they say are pretty powerful. This one in particular resonated with us. I never thought how I would speak up to address an unsafe situation. Always thought I could do that easily, but I found out that I really didn't know how to do that very well. This program gave me the language to use and the confidence to know how to speak up in high-stakes situations, and I loved it for that reason. And they want TeamSTEPPS as early as possible in the program. Any additional thoughts, comments, Mary, Pat?
No, I think that our students here at Ursuline have had wonderful opportunities to have this integrated early on, and I think we learned our lesson when we only put it in the senior level. Yeah. And I think that's that complaint that we didn't have TeamSTEPPS earlier in the program really spurred not only the faculty but students' buy-in to TeamSTEPPS and actually seeing it implemented outside of the educational realm, but getting involved with their practice partners, bringing the information to the practice partners was key to getting the entire team to buy in. And I also think the way that we speak as faculty here, we have huddles, we have briefs, we have debriefs, and I think the students hear that, and when we're doing it in the clinical area, really has an incredible impact on them.
I agree.
That concludes the presentation. Chris?
Thank you, all three. That was really wonderful. Good job. I'm sure you're getting applause around the country right now. You just can't hear it. But really wonderful. A lot of people, before we get to questions, a lot of people have been asking the question of if they can have a list of all of the videos and other websites and links you'd put in there that were not a part of the official AHRQ TeamSTEPPS program. And yes, of course, we will provide that to everybody. That's something that we'll be able to put up along with the recording of this webinar. I know that there are some folks from the DoD on that can't access YouTube because of DoD regulations. I really don't know. Like I said, a lot of the videos are fun videos that show a lighter side of teamwork, or some of them are videos that are just not a part of the official curriculum. And so I just know of them being on YouTube, so I don't know how we can help there, but we'll see what we can do, what we could find. So are the three of you ready for some questions?
Yeah, sure.
Sounds good. First question that I would have for you guys is, when you were talking early on about the learning strategy where you have students work in teams and comment how to react after seeing a situation, there was more than one question about if you had developed a specific toolkit or some sort of directions just how to run that program, or if it was just something you were doing.
If they're referring to the very early encounter where we do the patient safety observations, we don't really have a toolkit. They're very, very new at that point, so we just show them that using a structured tool is a much easier way to communicate as a new nurse, as a new nursing student, and as a seasoned nurse. So we model that and just sort of tell them that's what this TeamSTEPPS course is going to help you do, is to organize and to communicate effectively as part of a team. I don't really have a kit. I'd be willing to share how we set the rooms up if that would be helpful.
We approach it too, Mary, much like muscle memory.
Yes, of course.
Really practice. Role-playing simulation, looking and accessing those TeamSTEPPS videos, ours as well, and then breaking out and debriefing, as we know that is an important component of probably the best atmosphere for learning is in the debrief. So
yes, right.
Definitely.
Yes.
Thank you. So when you are talking about it, Laura, when you were talking about your level 1 work, you were talking about a trust exercise. Can you provide more detail about that trust exercise?
Oh, absolutely. And actually that is something I gained from the national conference. TeamSTEPPS National Conference. It was a presentation, I believe, was at University of Washington. Forgive me if I'm not correct, but it is Pat?
It is.
Yes, it was awesome presentation at the national conference, and if those educators have the chance to attend a national TeamSTEPPS conference, please do so. It's amazing what you learn and
very
gain
powerful.
But it's on YouTube, and I believe it is called the Trust Exercise. If you Google it, and it has two girls at a little slumber party, and it's that whole thing where you fall back and the person catches you. And I won't give it away, but Google Trust Exercise. And it's I think it's 30 seconds long.
I believe
yes.
It's trust, fall, fail is the proper.
Trust, fall, fail. That's right.
That's right. It's a great example of having a shared mental model.
Yes. Absolutely.
Yes.
So, other than students presenting TeamSTEPS to clinical staff during rotations, do you have other examples of how academics or clinical sites work together to support student learning?
Yes, if you think about the leadership course, we briefly talked about some of the things that they do, but our students actually complete a quality improvement project with the team at the clinical site that they're assigned to. And part of that includes TeamSTEPS. They may be doing teaching them about the tools, teaching them about teamwork and collaboration in general, but they establish some sort of review of the literature for them and then do a presentation overall about how they could improve their practice in the clinical area.
I think that's an important point too, Chris, for education. As we know, it's difficult to bridge that academic practice gap. With TeamSTEPS, it is a connection piece, if you will, for those two areas. So we put up on our learning management system prescriptive clinical assignments, introducing and a progressive fashion with the constructs and tools and strategies. They have actual assignments that they do, and that's ongoing. We change those up all the time.
One other way that we've offered our partners, our academic partners, our practice partners, to use TeamSTEPS. After Katrina, we have lost many hospitals, so we finally now have opened a brand new academic and medical center. So the faculty here at the nursing school have offered to help trainers over there. Like we're extending, since many of us are TeamSTEPS certified to teach the course, we've offered our experiences and even our time to work with them as they begin, because they have indeed expressed an interest in training all of their team workers, their healthcare workers, in the TeamSTEPS program. So, I think offering, to spread this idea of teamwork, and I think it'll just be really helpful for the students too to see us in that role of trying to lead it in our practice partners and in the affiliating agencies in the greater New Orleans area.
So there's been, and this will be our last kind of question because I know we're almost at the top of the hour, but there's been, incredible amounts of success in the field and in hospital settings where TeamSTEPS is being utilized either hospital-wide or in a specific unit. But I really think that coming from an educational standpoint, this is some of the most important work that's being done with TeamSTEPS right now, because people are, getting it when they're young, getting this education right away, like that one student quote that said, I wish we'd had this earlier.
Yes.
What can you provide these students going out into the world with to help them encourage other people in the organizations they arrive at if maybe this isn't a part of the culture of where they're showing up? How can they, what kind of tools do they have if they show up in an environment where this maybe isn't standard yet?
Well, I will tell you, this is, Laura, did you want to go?
Oh, no, Pat, it's a great question.
It is a great question, and really very important. One of the things that we do in our leadership course is let the students know they might not be employed in a culture that advocates this type of an approach to teamwork and collaboration, but they can start small. For example, if they're an RN working on a unit, they can begin to do briefs and huddles and debriefs with their nursing assistants or with their team, just to begin to bring a change in the culture, because they really need to keep these things ingrained and not be discouraged. So I think even starting with the small tools and constructs and being a leader out in the community would be key.
I agree.
As well.
Thank you guys very much. There are a lot of questions I know we didn't get to, and we will certainly get to them and be able to post the answers to those questions. We'll work with all three of your presenters today to come up with the answers to those questions. So thank you all very much. Mary, Pat, Laura, thank you very much for...
Thank you, Chris.
Thank you.
Chris. And thanks, everyone.
Thanks, everyone. Yes, we enjoyed it.
All right, thank you, ladies and gentlemen. This concludes today's teleconference, and you may now disconnect.